Hi, I'm Erica Whitney, and this is my presentation for CJ 301, Language Barriers in Healthcare, Intercultural Communication Challenges, and Solutions. So first, I want you to imagine being in critical condition but unable to communicate your symptoms due to a language barrier. This scenario illustrates a significant challenge in healthcare today, according to Muter. So, language barriers result in misdiagnosis, misunderstandings, and disparities in care. This topic is personally important to me because I think as a public health major, I recognize the importance of healthcare equity and ensuring that all patients receive quality care, regardless of their language or their culture. So in 2024, with the increasing of migration, which is according to the U.S. Census Bureau, healthcare systems are serving more linguistically diverse populations than pretty much ever before. So addressing language barriers is crucial in our interconnected world, and that's according to Vandy Castile of 2024 and other authors. The overall key concept I want to tie into intercultural communication is the idea of cultural competence. An NIH article by Beach of 2005 says that cultural competence involves the ability of healthcare providers to effectively understand and respond to the cultural and linguistic needs of their patients. So this concept is, I think, absolutely critical for bridging that communication gap and ensuring equitable care in healthcare. All right, so language barriers in healthcare, like I've discussed, create significant communication challenges between patients and providers. This can lead to misunderstandings, misdiagnosis, and overall inadequate care for that person. Some research from the article Journal of Patient Safety and Risk Management and the language barriers between nurses and patients both discuss how these barriers can increase the risk of medical errors. And also, language barriers do contribute to broader healthcare disparities, which is noted in a World Migration Report of 2024. This is emphasizing the need for culturally competent care to ensure that there is equitable treatment. Now, if we're looking at why this all really matters, let's first look at the micro level. Language barriers affect individual patient-provider interactions. Patients often struggle to accurately explain their symptoms, which can lead to misdiagnosis. The article, the Language and Cultural Disorders article, discusses how these communications breakdowns increase the risk of medical errors. Additionally, also the Journal of Patient Safety and Risk Management points out that these barriers can result in lower patient satisfaction and adherence to treatment plans. So that is the micro level. Now, at the meso level, healthcare providers or healthcare institutions face operational challenges. Hospitals often will struggle with that resource allocation due to that need for interpreters and also additional staff training, pretty much. And according to the article Overcoming Language Barriers in Healthcare, these challenges can lead to longer wait times and increased workload for healthcare staff, which affects the overall efficiency and patient care quality. Now, looking on the macro level, language barriers contribute to broader healthcare disparities. The World Migration Report of 2024 shows how linguistically diverse populations often face unequal access to healthcare services. This calls for systemic solutions and comprehensive policies to ensure that all patients, regardless of their language, receive equitable care. Now, I want to do a overview of some solutions that I have come across in several of the articles that I read. So, to address these challenges, some solutions include enhanced interpreter services, cultural competency training for healthcare providers, and the development of multilingual health information systems. And I think that each solution definitely has its benefits as well as its challenges, which we will kind of go through both of those in the next slides here. So first, starting with enhanced interpreter services. This plays a big role in bridging that communication gap. They ensure that patients fully understand their diagnosis and their treatment plans. This is improving overall satisfaction, as discussed in the article by Soled 2020 and Gerchow and other authors of 2021. So, however, I think that the availability and cost of these services can be a challenge for some healthcare institutions, limiting their overall widespread implementation of this service. But it's definitely a good step. And then overall, I think as somebody who values clear communication, kind of as a public health major and just as a student and as an employee, I think I can't help but think how comforting it would be for patients to have someone who understands their language, kind of nuances during critical health discussions. All right, and now looking at that cultural competency training. This equips healthcare providers with the skills to better understand and respect the cultural backgrounds of their patients. According to Beach of 2005, this training can improve communication and build trust, ultimately leading to a higher patient satisfaction and better health outcomes. And once again, I think that beyond just learning about different cultures, this training will definitely foster that empathy and respect that these patients are needing, which is absolutely crucial in healthcare. All right, and then the next solution, multilingual health information systems, like patient portals and educational materials in various languages, empowers patients by providing accessible information. And this is shown in the article by Muter of 2015. This approach improves patient engagement and self-management. Now, the challenge with this is implementing these systems requires a lot of investment in that technology and resources, but overall, I do think that since we are in this digital age, I see this as a big opportunity to leverage that technology for that inclusivity that we need. I think it's exciting to think about how technology can empower patients by giving them that direct access to their health information in their own language. So let's kind of evaluate all these solutions that we went over. When evaluating these, I think we can consider criteria like accessibility, cost effectiveness, and their impact on patient outcomes. Interpreter services definitely offer immediate improvements in communication. However, that can be costly. Cultural competency training addresses long-term communication and trust. And so kind of combining these solutions definitely provides a comprehensive approach, effectively addressing both immediate and systemic challenges. So overall, my research about language barriers in healthcare has definitely confirmed that those language barriers definitely hinder effective communication in healthcare, which is something that I definitely expected to see and to find. However, I think what stood out was the profound importance of that idea of cultural competence, which I talked about in the beginning. Not just as a kind of complement to the language solutions, but like also as a critical factor in fostering long-term improvements in that patient to provider relationship, right? So again, kind of combining the interpreter services with the cultural competency training has emerged as the most comprehensive solution in the end, pretty much. Now, despite these findings, I still have some questions, and maybe you would have some questions too. For example, how can we leverage emerging technologies to further enhance multilingual communication in healthcare settings? Just a question to think about, and one that I have right now. And then also, I'd like to explore that like long-term impact of combining cultural competency training with interpreter services on overall patient outcomes. So maybe there's some articles about that out there that I didn't catch on to, but that's just something that I would like to maybe see on this topic. So overall, in conclusion, I think addressing language barriers is definitely not just about improving communication. It is also about ensuring equitable healthcare for all by integrating effective communication strategies with cultural understanding. Now we can create a healthcare system that truly meets the needs for every patient, and that is regardless of their language or cultural background, which is definitely a big takeaway from this class. And here are my citations. Thank you.